Hi, this is Shelley Kraft, and welcome to SNNLive. We're at the Southeastern Medical Device Association 2013 conference at the Georgia Tech Global Learning Center in Atlanta, Georgia. I am here with Dr. Elizabeth Ofili of AccuHealth Technologies, a private company. Dr. Ofili, I'll call you Elizabeth, okay?
Thank you.
Welcome to SNNLive.
Thank you for having me.
You're
Shelley.
quite welcome. Let's get right into it. Give us the quick overview of the company, if you would.
So AccuHealth Technologies is developed to address a critical question in chronic disease management. Specifically, we have a large number of patients with multiple comorbidities. They do not properly address their health care. So what the technology does, it provides an integration to allow patients to self-monitor, manage their care with the help of a health coach. And importantly, the data gets transmitted to the physician, so that way when the patient comes into the doctor, the doctor is ready with information that was derived from the many weeks and months when the patient was away from the office. What we find with this technology is that patients feel empowered, and clinical studies that we've done now has shown significant improvement in the clinical outcomes in patients with diabetes.
You hit a chord. What I see is personalized medicine.
That's correct.
Number one. I see electronic medical records, number two.
That's correct.
I see medical communication with patients who don't want to take care of themselves, almost having to. Yeah. Am I hitting it?
That's correct. And absolutely, the key here is that the technology enables medication and other behavior adherence. And importantly, the communication piece, because when doctors interact with patients in the office, it's a 10-minute encounter at the most. Patients leave the doctor's office confused about the whole process of care. And this is more so in our elderly patients and patients with multiple health problems. So the integration here with the electronic medical records, the personal health record, and importantly, what the patient has actually measured and monitored, is the power. But I think too, the fact that we have these trained health coaches that are now part of this telehealth workforce adds significantly to the benefit.
Tell me how it benefits a diabetic patient.
What a diabetic patient has to do when they're faced with this diagnosis, they have to monitor their blood sugar. Their blood pressure is an important part of their outcome, and the doctor says go ahead and exercise. And then, oh, by the way, you got to take your insulin, you got to take your medicines. Patients get confused. And what happens with the technology now is patients go through a process where they learn, based on the American Diabetes Association guidelines, how to actually become more efficacious in managing their health. And what we found is the key measures of a diabetic patient doing well, the blood pressure, the blood glucose, the activity level, all go in the right direction. And that's what's so exciting about the technology.
So the health coach
Yes.
works with the patient
Yes.
to get them more monitored,
Yes.
so that the information can get back to the doctor and they have more time almost online than they do with him in the office, correct?
That's correct, absolutely. What happens here is this is an online system, and it is now on a mobile platform. The patients working with the health coach actually meets the patients sometimes at their home and sometimes in a restaurant. They learn what it is the patient does right or wrong and puts that into part of the equation in getting the technology adopted. So patients actually learn several things, not only about their disease from the standpoint of a health literacy standpoint, but also self-empowerment in addition to using this technology that used to be foreign to them.
Whose idea was this?
Many of us. We have a wonderful team. The whole issue came up with my frustration initially because I'm a cardiologist, and when patients come to me, they have multiple problems. Diabetes is a big driver, and it's hard to control. So I thought maybe we can solve this. I partnered with a wonderful individual who's a brilliant software engineer, and we came up with this idea to develop this and put it out there in the marketplace, and so far it's going well.
I got a tough question for you.
Yes.
What's your website?
www.AccuHealthTech.com.
Spell it. The TECH at the end?
Yes.
So it's AccuHealthTech.com, right?
Exactly. AccuHealth, then tech, TECH.com.
Ladies and gentlemen, Dr. Elizabeth Ofili from AccuHealth Technologies. I'm Shelley Kraft. This is SNN Live. We're at the Southeastern Medical Device Association 2013 conference at the Georgia Tech Global Learning Center here in Atlanta, Georgia.
Thank you so much, Shelley.
No,
appreciate
thank
it.